Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about generic and brand name drugs. So a brand name drug is a drug that is sold by the manufacturer, the company who developed and tested and brought a drug to market and sold as a brand name. A generic drug is the same medication, but after patent runs out, they're allowed to take the basic chemical formula and mix it up and sell it as a generic drug without having any of the expenses of research development and bringing it to market. I'm going to break it down into 4 different classes. There is brand name prescription drugs, and an example would be Prilosec, the stomach medication. So you get a prescription from your doctor for Prilosec, either 20 or 40 milligrams, and go to the pharmacy and get Prilosec made by the company who developed it. It's available as a generic omeprazole, so you can get a prescription from your doctor, go to the pharmacy and buy generic omeprazole for a little bit cheaper than the Prilosec is. And now it's available over the counter as Prilosec OTC, over the counter, so still made by the original manufacturer but sold without a prescription. It is in the smaller 20 milligram dose, not the 40 milligram dose. And then they have generic over-the-counter omeprazole, which you can buy as a store brand, same medication, also without a prescription, and a generic and a little bit cheaper than the brand name. Almost always a generic medication is going to be as good and as effective as the brand name medication. You probably generally don't have to spend the extra money, either cash on the brand name, or if you have a different copay for brand names versus generic, you probably want to stick with the generic drug. It is the same exact chemical formula as the brand name. It just doesn't carry the brand name with it, and it's going to be a lot cheaper for that reason. There's a couple of possible exceptions. There's certain medications like Synthroid or thyroid medication, which is such a minuscule dose, and the range of dose is very, very different. It's in micrograms or 1/1000th of a gram dose, so a very, very small change in the medication may make a clinical difference to you. So when the FDA says something is clinically equivalent, they use Synthroid as the benchmark. So 100 micrograms of Synthroid, if I gave you that prescription and you bought the brand name Synthroid, I could guarantee that you would get 100 micrograms of the thyroid medication. If you bought a generic medication, anywhere from 80% to 125% of the availability of Synthroid would be considered equivalent. So if you went and got a generic Synthroid, it might be as low as 80 micrograms, and it might be as high as 125 micrograms, and that's about 4 different doses in that range. So 88, 100, 112, 125. So there's 4 different doses you might be getting every time you went to the pharmacy and got that 100 microgram dose. Now, if you stick with a consistent generic manufacturer, say Watson makes your generic Synthroid, and say it's 80 micrograms, that's actually not a problem, because you go to the doctor and you get a blood test and he adjusts the dose. So even though the bottle says 100, you're actually getting 80. Your blood test will reflect with how much you need, and maybe the doctor puts you on 112 or 125, which would be more equivalent to the 100 of the Synthroid, but you're saving $50 a month, and it's not a big deal. Where it does become a problem is if you get, say, Watson brand of thyroid medicine 1 month, and it is actually 80 microgram equivalent, and then you get Sanofi brand the next month, and that's 125. You're literally taking a different dose every time you get a refill of the medication. You can actually work around this by keeping an eye on what generic you get. So the bottle should say Watson Pharmaceutical, and you know that you're getting Watson brand consistently. Some pharmacies will bounce around and shop for the cheapest, so they may give you Watson 1 month and they may give you Sanofi the next month if it's a couple of dollars cheaper. You can prevent this by keeping an eye on what brand you're getting. Don't throw your old bottle away. When you get your new bottle, look at the old bottle and see if it says Watson, and look at the new bottle and see if it says Watson, and then you know you got the same prescription again. You can buy 90 days or even pay cash and buy 180 days at a time, and then you know you get the same manufacturer for at least that time period. There's a couple of other nuances to generics. Some generics will use different coloring agents, so if you have a specific color dye allergy, you may not tolerate one brand and have an allergic reaction, but tolerate another brand. There's different fillers in them that can help or cause absorption issues, but they're very, very subtle. So if you're talking about a blood pressure medicine or cholesterol medicine, or even a diabetes medicine or an acne medicine, absolutely the generic is going to be fine for you, and almost always even very delicate medication like Synthroid or Digoxin, the generic is going to be okay. But if you do have problems with your medications, you may want to look into either going back to the brand name or sticking with a consistent generic. So 99% of the time you're okay with the generic. You're going to save a ton of money from the brand name if it's available as a generic. I would not be afraid of the generic. If you have a problem, you can always ask your doctor to go back to the brand name, but you might expect to pay a little bit more money. For your help, Dr. Greg Castello, thanks.